This presentation covers childhood sexual abuse and its effects on women by Lauren Cooper, Laura Ward, and Stacy Rush. During this presentation, we will cover the identification of childhood sexual abuse, how childhood sexual abuse is a problem, the effects of childhood sexual abuse, specifically in women and African American women, spiritual influence, as well as treatment methods that are currently being utilized in adult women who have experienced childhood sexual abuse. There is no uniform definition of childhood sexual abuse, which can greatly influence the statistics reported. There are several forms of childhood sexual abuse. It can be seduction from a relative or severe violent act committed by a stranger. The impact of childhood sexual abuse varies from person to person and case to case. Many women who have reported childhood sexual abuse have experienced relationship insecurity, low self-esteem, self-blame, low self-efficiency, sexual behaviors, less positive coping, post-traumatic stress disorder, and less resilient on social support as a means of coping. Studies show that children who experienced rape or attempted rape in their adolescent years are 13.7 times more likely to experience rape or attempted rape in their first year of college. Frequent studies has also indicated that around 63% of women who have suffered sexual abuse by a family member also reported rape or attempted rape after the age of 14.
Our literature search revealed many devastating effects of childhood sexual abuse on women. We will cover our main findings in the areas of physical, psychological, relational, and spiritual problems common to survivors. Physical, increased cortisol levels and emotional repression cause a repressed immune system, greatly affecting the body's ability to heal itself. Digestive and gynecological issues exist as well, and survivors also often make poor health choices, such as smoking and being overweight. Psychological effects. Low self-esteem can lead to higher incidence of depression, eating disorders, suicide attempts, substance abuse, and PTSD symptoms. Relational effects. Because of a distrust of others and low self-esteem, CSA survivors experience problems in establishing healthy relationships. They are often re-victimized by others. They experience high levels of sexual dysfunction in their relationships and often find mothering their children difficult. King, Wardecker, and Edelston's findings show that survivors' homes are more negative, conflictual, and chaotic, more than women who have had no sexual abuse as children. Spiritual. CSA survivors are often distrustful of God and feel anger and a sense of abandonment and betrayal. Some stop or decrease participation in religious activities. Others, however, lean into their faith, substitute their negative attachments with trusted adults for attachment to God, and often find healing, hope, and meaning to life. The African American community appears to be hit especially hard with the problem of childhood sexual abuse. L. Bassel and Associates suggest that cultural views of sexuality in these communities may be a cause of higher rates of sexual abuse. They write that in many communities, African American women are taught to be sexually passive to men, and that sexual promiscuity is more accepted. The rate of abuse is estimated as high as 44% in this community, as compared to 20% nationwide. While African American survivors experience the same effects as listed on the previous slide, they also have experienced the following. Number 1, higher levels of cortisol, as tested in hair samples of pregnant women when compared with other races. 2, higher instances of substance abuse. 3, risky sexual behaviors, such as having many partners, having unprotected sex, participating in prostitution. And that leads to a devastating statistic in number 4. HIV rates in African American women are 15 times greater when compared to those of Caucasian women.
There are many treatments for CSA survivors, primarily because there are so many different issues that arise from the abuse. Oftentimes, there are multiple issues being treated at one time, or there are more pressing issues that need to be treated before the abuse can even start to be processed. Physically, there are many issues, all of which have been discussed already. For physical issues, particularly STIs, gynecological issues, or pregnancy, there are many organizations that offer resources and help. There are local clinics, women clinics, and oftentimes Planned Parenthood locations that offer reduced or free testing and counseling. For psychological issues, eye movement desensitization and reprocessing, or EMDR, exposure response prevention, creative arts therapies, and in some cases medication, are all utilized for treatment. In short, EMDR is an 8-phase process that is used primarily to help accelerate the processing of the trauma and to reduce the emotional response to the trauma and to reduce symptoms of PTSD. Exposure response prevention is a similar idea. ERP is a form of cognitive behavioral therapy and exposes the survivor to the memory of the trauma and helps her to confront fears and emotional responses related. Through this therapy, clients can also experience help with anxiety, eating disorders, insomnia, and even substance abuse, all of which are common in CSA survivors. Some creative therapies, particularly storytelling, also help survivors process the trauma. A story helps the survivor approach the trauma from the outside and also offers a container to put the trauma in because stories have a beginning and an end. This way, the survivor feels more in control of the memory and can process it in a safe, contained space. To treat relational issues, group therapy has proven to be helpful for CSA survivors. They can learn to build relationships in a safe environment, as well as hear stories from other survivors, giving her a sense that she is not alone in her suffering and her experience. Cognitive behavioral therapy can also help with relational issues. It can help pre-process the trauma and reshape the thoughts about the trauma. With CBT, the survivor can start to regain a trust in others and in God. The issue of CSA and its effects, particularly in women, is vast. The implications of abuse and the treatments are all complex and intertwined. As a group, we have taken the stance that more research and work needs to be done to prevent childhood sexual abuse. The effects are detrimental physically, developmentally, psychologically, relationally, and spiritually, and it must stop. Thank you for listening, and we hope you learned something new.